Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN. I would like to officially welcome you to episode 267 of the Ask Dr. Angela podcast. This Sunday, it appears that spring may have finally arrived. I'm not exactly holding my breath because it can be 80 degrees one day and then a blistering 30 degrees the next. But so far this weekend, the weather has been pretty consistent, and I'm hoping that you all were able to get out and enjoy it somewhat. It was really nice seeing kids outside riding their bikes, just people getting out in general. Let the winter be gone. And even though I do realize that spring has officially arrived, it doesn't seem to have shown up. So today's question comes to us from Christine, and she reached out to me via email, and this is what she had to say. Dr. Angela, is it safe for a pregnant woman to drink 8 plastic water bottles a day? This is how much I drink. Should I be concerned? That's a really good question. And certainly, hydration is an important part of all of our well-being, irregardless of whether or not you're pregnant. During pregnancy, however, it's a lot more important because certainly staying hydrated during pregnancy can help to prevent many different things, whether it's urinary tract infections, constipation, which can lead to hemorrhoids. Staying hydrated also helps with things like fatigue, keeping headaches at bay, and contrary to popular belief, making sure that you're adequately hydrated also helps to decrease the amount of swelling that a pregnant mom can have. We all know about swollen hands and feet and legs, which certainly occurs during all pregnancies. So just how much water should you be drinking during pregnancy? What most of the literature suggests is anywhere from 8 to 10 8-ounce glasses of water daily. I don't know about you, but even in a non-pregnant state, I personally have a difficult time consuming a couple of glasses of water a day. Certainly that recommendation is going to vary from individual to individual, but one rule of thumb that I always give my pregnant moms is that a good way to keep tabs on your hydration status is to take a look at your urine. When you urinate, your urine should be clear, light yellow, like weak lemonade. If it's starting to become dark, brown-like, or looking like Arizona tea or tea in general, that means that you're probably not hydrated enough. The other important reason to stay hydrated is because if you become dry, the uterus becomes very unhappy. You can even have preterm contractions if you are not adequately hydrated. So, in general, 8 to 10 glasses of 8-ounce. So just in general, between 8 and 10 8-ounce glasses of water daily. But again, if that seems like it's a lot for you, keep tabs on what your urine looks like. And again, certainly, if your urine is crystal clear or very light, you probably are hydrating enough. I know sometimes we get really tired of drinking just water. So, there are other things that you can drink to kind of help keep you hydrated. If you're a milk drinker, that certainly will help. I was not really able to tolerate milk during my own pregnancy. You might consider sparkling or flavored waters, fruit or vegetable juices. Just make sure that you watch out for sugar content, and decaffeinated teas are also a good choice. So just some alternative things to water that may pique your fancy, so to speak. So in closing, I would like to thank Christine. Thank you so much for sending that question. It's a really good question, and it's one that I know a lot of pregnant moms out there had, and certainly by you sending it, they too will be informed. So In closing, thank you so much for all of your continued support. If you happen to have a topic, question, or issue that you want discussed on the podcast, you all know how to reach me. You can hit me up at askdrangela.com. That's askdrangela.com. From there, you can click on the big question mark and submit your question. You can also direct message me on any of my social media avenues. That's going to be on Twitter, Facebook, Instagram. Pick your poison. And certainly we will get to your question, or I will get to your question as soon as possible. We are getting so many questions from so many different places, and I promise you we will get to them. In closing, I'm going to read a quote from another one of my favorite little books. This comes from Life's Little Instruction Book, and instruction number 292 says, "Don't burn bridges. You'll be surprised how many times you have to cross the same river." Just some food for thought there. Until next time, look better, feel better, be better. Looking forward to reconnecting on episode 268 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.